Great. Okay, so welcome to this virtual yoga, excuse me, this virtual wellness class. My name is Karen Vasil-Busch, and I've been a massage therapist for over 35 years, and I am an Ayurvedic practitioner. And today I'm going to be talking about better bone health. I have a short PowerPoint presentation, and we'll get into it, but I wanted to just start slowly for a minute, maybe explain to some of the folks out there who may not even know what is Ayurveda. And Ayurveda is, it's called the science of life. It is from India, and it's one of the oldest healthcare modalities in the world. It's over 5,000 years old, and it looks at the whole person. So it considers the mind and the body as being interconnected, and it sees the importance of lifestyle, and particularly four things: your mental mind, looking at maybe meditation and mindfulness, be part of that, of course, and diet, what you eat for nutrition, how you're sleeping, and also what they call purification, which is really how in women it's menses, and men don't have that, but it's purifying on a seasonal basis, and it's looking at how the body naturally does this throughout its life, and that our body, of course, has different stages in life. And I think probably Western medical science sees that too. But Ayurveda uses plant medicine also. And some of the things can be very simple, but it's almost like retraining your mind to understand Ayurveda. When I went to school, even though I have studied, traditional massage, of course, anatomy, physiology, that type of thing. But I've always been a really intuitive person. And I think that's a good thing for Ayurveda, because Ayurveda is an art as well as a science. So the idea is that there are three doshas, three elements that are made up of Vata, which is air and space, Pitta, which is fire and water, and Kapha, which is earth and water, are, kind of poetic, but they actually are in our physiology. And it seems simple at first with Ayurveda, but it's actually very complex. So I have a lot of respect for the doctors that they're called Vaidya's that I've studied with, and it's a learning curve. At the same time, there's a simplicity to it that we can all understand. So today, in talking about better health for our bones, I will be talking about the Western concept of osteoarthritis and rheumatoid arthritis, just to get us started. But in Ayurveda, they would look at that as being a blockage somewhere, that ama, the undigested part of food that stays in our gastrointestinal tract, and then it can kind of cause blocks in the channels in the body elsewhere. And the idea of removing the blocks can be gradual, and it's all based on the patient. They call it rogi, the strength of the person. So, and that's where we're at with that. And of course, with osteoarthritis and rheumatoid, they're usually slow progressions. As a massage therapist, I've worked with people with both OA and RA, and massage can help, certainly emotional component. It can help relieve stress, it can help improve their sleep, and it feels good. And that's a really important thing. Sometimes the range of motion can be increased, but we're not, like I say, it's a comfort. So it's a comforting thing to do. So let's get started with the PowerPoint. I'm going to go to I have to talk about this out loud because there it is. Go to my screen share, I hope. And sorry, I have to come close to the screen because I really can't see from. Okay, there. back up a little bit. Yeah. So, like I said, this class is going to be about better bone and joint health, and it's going to be from the concept of East and West. And I already mentioned who I am and what I do. So we'll, whoops, sorry, just lost you again. My mouse is very sensitive. All right, we'll go on to the next slide. So I said it's a multifaceted approach, drawing upon the tradition of the East. And by East, I mean from Ayurveda and herbalism, which is actually in the West also. You know, Americans use herbs a lot, and we could talk about some of those. And the Western, our Western medicine. And I'm going to talk about support for bones and support. Mainly support for bones is through herbalism and nutrition. There's a very good book, and I'll probably mention it more than once, but it's by a woman named Susan Weed, and it's called The Wise Woman Herbal. And it has a lot of recipes for making drinks that support our bones using American herbs like nettle, burdock, and that's a resource I think, you know, I use that book just all the time, you know, throughout my life. I've used that book. And then I'm going to talk about the herbs, of course, for relief from the Ayurvedic herbs. I want to also say that this talk is for educational purposes only. It's not meant to be a substitute for medical care or advice. It's not medical advice. It's not meant to take the place of your primary care provider. So, you know, just so you know that. And because I do believe that Western medicine has its place, and that Western medicine and Ayurveda can work together. There are some, you know, we're continuing on that journey. So here's the thing about osteoarthritis. I mean, what is it? Basically, I just put down some bullet points that it's a breakdown of cartilage, which leads to decreased mobility. And there is, like I say, there's no cure, but there are treatments that can help to temporarily relieve pain. Because when it breaks down to a certain point, you get bone on, you've heard people talk about bone on bone, but it can be very painful. Usually osteoarthritis is in the, you know, it can be in the hands, the knees, you think about weight bearing, the hips, can be in the spine, of course, the neck, any place that turns, you know, that moves, because osteoarthritis also can be caused by repetitive movement. I mean, I have some actually in my finger from a massage. My finger is kind of turning, and you know, I use Ayurvedic warm oil to help treat it. It's not going to cure it, but it's still pretty mobile, you know, but it is from my repetitive use. I've been really careful. I've been blessed with not having any injuries after massaging. I want to say since 1982 and full-time for the past 20 years. So, you know, I've proper mechanics, but still some things you can't escape, you know. So as you age, sometimes, you know, people can't escape, you know, maybe shrinkage in their spine and, you know, getting arthritis. Some doctors say we get this at the age of 30, we're heading into that land. So, you know, the other treatments that massage can reduce stress and anxiety, encourage the sleep. So just a couple of facts. So treatments can slow the progression and improve joint function and relieve pain. These symptoms develop slowly. Like I said, with my finger, I didn't notice it right away, but you know, then it started to become stiff, and then I started to see how it was changing in its little bit of a shape. And you know, with osteoarthritis, sometimes the joints are stiff upon awakening, and pain can create certain, you know, during certain actions can create pain. And for some people, it's worse at the end of the day. So if it is worse at the end of the day, you know, with osteoarthritis, the best thing is to rest and maybe to look at restorative yoga. Restorative yoga can be very soothing, you know, like a simple legs up the wall or up a chair, you know, can be very soothing with support for the back if it involves the spine, or, you know, if it involves the knees. resting them, with bolsters, of course. So there's a lot of different ways we can look at making the symptoms, reducing them. Does some of the things I learned when I took a class in massage and osteoarthritis was that OA affects women over the age of 65 more than men, but men under 55 more than women. And 27 million people have osteoarthritis. It can cause damage to the subchondral bone, the joint margins, the synovium, the joint capsules, the bursters, and tendons. So it can really be, difficult. But a study by the Touch Institute, which is a funded institute in Florida, I believe, that studies massage, found that Swedish massage can reduce the pain from osteoarthritis. It doesn't necessarily increase the range of motion, so that multiple modalities are used. And in my practice, I've used multiple modalities because I know of I guess what you call deep tissue, but I call it myofascial work. So after the multiple modalities were used in some of their studies, they noticed that benefits were accrued after about 6 months. So I'm going to go on to RA. So rheumatoid arthritis is an inflammatory arthritis. It's a different type of thing, and it is very difficult to treat from Ayurvedic perspective. Usually people are on strong medications for this because they need to be, because it's immune related, and it's the body, it's an inflammatory related, so they might be on a steroid, a strong formula. So that massage can help them mentally, and it can also help can help in that dimension. I didn't mention the fact about digestion being so important, but we will talk about that and what that means. And so I mentioned this formula, this herb Google, which is in a lot of Ayurvedic formulas, and it is a powerful Ayurvedic formula for treating inflammatory conditions, particularly something like RA. But you have to ask your primary care provider what Google formula you'd use. The classic one is called Tridosha Google because it has 3 other herbs in it that help with digestion along with this Google. And I'll talk about that in, I think, the next slide. But the other thing, I guess I didn't mention, but I will go back to OA, that resting, I mentioned that resting the afflicted joints help with osteoarthritis. And I'll probably repeat myself because my notes are a little scattered. I apologize for that. But I will say that castor oil packs help for osteoarthritis. I've used those on my clients. I've used warm. In Maine, we have this company called Grandpa's Garden that used to make these bags that had rice in them that you could heat up in the microwave, and they're marvelous. Very nice company. It's from on the coast, and they had ones that fit your hands, that little mitts. They have ones that go on the back, and I've used those in my practice. And because it's moist heat for OA, it relieves. It feels good. So this is the Google, the plant, the herb I was talking about, and it is a resin from the Indian myrrh tree, and its main use is for, it's called the Divine Rescuer. That's what my, when I went to school, I studied, I went to New World Ayurveda, and Dr. Paul Douglas, Western trained doctor, but deeply involved with Ayurveda. He understood that people could learn maybe 3 things at one time. Or he used to give us the name, give us a cue for what Google is. So he would give it a name like the Divine Rescuer because it did so much. It's a resinous plant, very similar to, very similar to myrrh. And you know how frankincense is also a resin. And it's interesting because frankincense is another a herb that is in some of the oils that are used to help relieve pain. So, it's all connected, but it's a sticky substance, and it helps with this stickiness in the body. So it's kind of interesting how that works. So you look for Google in formulas whose main use is for arthritis, rheumatism, gout. It has a special affinity to remove the ama from the body. And when I mentioned ama before, ama is a word that's used in Ayurveda that talks about the incomplete digested food. And that is because for many things, we can help complete our digestion. If I just take a step back here and say, how can we help complete our digestion? Well, drinking warm water throughout the day, and cooking, first of all, cooking the water, taking the water and boiling it in the pot and letting the water, the heavy water soluble gases release, so the water's a little lighter, will help the body digest its food. Eating in a calm environment, so not eating on the go. What happened in the 60s and 70s and 80s when we got fast food, and everybody's eating in the car. Well, your body is when you're driving is hopefully is on the lookout for all the things going on around you, even if you're not conscious of that. It's in the alert mode. And when you're digesting, you want to be in more of kind of a contented digesting mode. So sitting and eating in a settled environment is a simple way to help the digestion. And in the long run, this will help. All of the things I've noticed when I look at Ayurveda from the way I um, teach it in counseling, and I'm just a consultation Ayurveda person, not a doctor, but that it's slow progression, especially even in herbs. But I like that because that means that it's more natural, so it's slower. So with Google, there are some you would want to take that under the guidance of a practitioner because it shouldn't be used in things like active kidney infections or acute stages of rashes. And also, no herb, many herbs people aren't able to take them if they're on blood thinners. That was our rule number one that we learned in our training. And the formulas, the interesting thing about formulas are that they're built synergistically so that you have a main herb like Google, and then it has all its helpers that help the body assimilate it and digest it. So when you read a Google formula, you might see like 15 herbs on there, and the top ones are the ones that are have more proportion of that herb in the formula. But the smaller as the list goes down, you'll see things like maybe cumin, cardamom, fennel, long pepper, and those things are to help enkindle our Agni, which is something I should mention, that Agni is our fire, and every tissue layer in our body has Agnis that fire it off. And I'll talk about the tissue layers in a minute. Let's see what the next slide shows us. Okay, so Ayurvedic help for this is osteoarthritis would be resting the afflicted joints. I mentioned before the castor oil packs, because castor oil is a heavy, unctuous oil, and it's considered, generally speaking, that osteoarthritis is a vata in imbalance. Vata, because it is, remember now, vata is the element of air and space. So it drives everything. She's called the queen of the doshas. Vata fans the flames of pitta. Think about that. So if Vata fans the flame of pitta, you might experience indigestion or an itis, like a burning sensation. That's how it works. And then if it continues, it moves out of its home. It's sort of like you had a party, your teenage child had a party and it got a little too carried away, and every room in the house got a little bit, trashed or something. This is what happens when Vata moves, when any dosha moves out of its home. The home for Vata is the colon. So it belongs in that area in the body. Like the home for pitta is the digestive system, and kapha is the chest, actually, from the chest down to the knees. So it's just, that way of looking at different things. So when I mentioned Vata pacifying diet, that would be a diet that's warm and moist, because Vata is cold and dry. And if it's running through the body, it's causing a little havoc. So I suppose it would be like, if the party's getting too loud and they're throwing chips all over the place, you go in and you say, look, let's just all, let's calm down for a minute and, uh, have some tea or whatever. I don't know. You're just trying to, bring things down a bit. Let's go to the next slide. So this is one of my favorite oils that I use, and it is available from this company called Banyan Botanicals. And it is called Mahanarayan oil, and it supports muscles and joints. It works on replenishing um, the body. It's good for the tissues associated with bone, which I haven't mentioned yet, and I will mention the 7 tissue layers and talk about them, because Ayurveda has 7 tissue layers, and they consider that they work in a cascade fashion. So if one tissue layer nourishes the next and the next and the next and the next and the next. So the Ashti Dhatu is our skeleton, and this oil, it's bright orange. It smells like a little bit like clove. I don't have a list of all the ingredients, but you can go on their website and look at it. And that you could use this. It's a dense nutritive oil. It's got nutrition in it, and you could use it on the body, on an afflicted joint, and then put a warm cloth on that area, and it feels good. Sometimes, and I'll just tell you this, in the morning, I mean, I wake up and my neck's a little stiff, probably from, probably arthritis. Okay. So I'll take some oil, and this is what I use, is another type of oil, and it's orange, very orange. This is called Davantari oil. This is full of 88 herbs. And I'll put some on my hand and rub it on my joint. And then I'll take a wet face cloth and I'll put it in the microwave for 30 minutes, take it out, shake it out, pretty hot, and put it right on my neck, and it feels good. It does. You have to remember that oils do go into your body through your skin. So it does affect, and nourish the body. So that's a good one to do. For rheumatoid arthritis, sometimes that is not recommended to do oil. I took a course on pain and Ayurveda and pain at Kripalu, Dr. Anusha and Segal, and she mentioned fennel paste, making a paste of fennel. Now, fennel is a seed. She also mentioned wrapping it in a castor leaf, and I don't know where we could find a castor leaf in this country, but I think you could still make fennel paste if you had some joints that were rheumatic, and make a paste and put the fennel paste around the joint, and then maybe wrap it with a cloth. I haven't tried that yet, but there are many. This is just for a temporary relief. It's not permanent, but there are some things we can do. And I think I mentioned this already about the multiple modalities be useful for osteoarthritis of the spine, the hips, and lower back, and to help with flexibility, and also that study about Swedish massage, because it helps reduce stress, pain, and it's always, most trained massage therapists know how far to go, because sometimes people it hurts, so that we're going to be gentle, it depends on what's going on. You always find that out first. And then the next one is the 7 tissue layers. I just wanted to go over this because this is really an important piece of information that is, I think, this is original to Ayurveda. So these 7 tissue layers, the rasa is the blood plasma. So that's the liquid in the blood, the light, it has to do with actually lymphatics too. So dry brushing, I was taking a seminar and a naturopath was talking about brushing. And I thought, wow, that's Ayurveda. We do dry brushing on ourselves because it stimulates lymphatic, because the lymph doesn't lymph lives very close to the edges of the skin. And we have ducts, but we also have little tiny, lymph that are right below the skin, like 5 millimeters below. So that is helpful. It moves to help circulation. And then you have Rakta, which are the red blood cells and the red blood cell organs, like the liver. That's part, that's the red nutritive part. Then you have muscle, mamsa, and then you have meta, the fat. And in the fat, there are hormones that operate in the body. Even after menopause, there's estrogen in those hormones. So there's hormones in the fat cell. So they're important. Then you have the ashti, the skeleton, and then maj is the bone marrow, which includes some of our immune system, our strength, and our bala. And shukra is the reproductive tissue. And so this whole system, these 7 layers, work in a cascade fashion when they're constantly transforming and they're receiving nutrition from us, from our food, and then they're building, and then they go, to the next one, the next one, and the next one in this order. And because we're mammals, it's kind of interesting, the last one being reproductive tissue. I think that's because we're a mammal. So our body was made so they could continue the species, the race. So that's why, you have all this stuff these things going on. So herbs, I think I mentioned in a nutrition class once that herbs have the greatest influence on our body. And herbs will affect all of these tissues in different ways. In our Ayurvedic classic pulse taking, feeling the pulse on the left hand for women and the right for men, you can feel a practice practitioner can feel the 3 doshas, Vata, Pitta, Kapha. Then they can feel the tissue layers, so they can tell which one is might be needing some assistance going into the subdoshas and the tissue layers. But anyways, just wanted to say that, so they work in a cascade fashion. If one of their development is blocked, then things won't be nourished well down below. So say, for instance, the rakta, the blood is a little bit, it's not doing too well. Well, then the muscles may not do well, and it may show up as rashes in the skin and things going on because the blood is impure. A lot of our rashes today have to do with, or skin disorders have to do with having to use herbs like a mangista, which would purify the blood, which would help then reduce even acne. There's a lot of work that they do with that in the Indian tradition. So if we get down to the ashti part, where I think you'd have bone health, what you want to think about is how do we nourish our bones? Well, one of the things we can do internally is to drink bone broth. I've seen that. I think it's become pretty popular now. The bone broth you can make it, of course, in a pressure cooker. Get bones and pressure cook them. But the bone marrow, some of us might even remember. I know my grandmother, because she was from Albania, would crack the bones and eat the marrow. I think it's a tradition. People knew, the herbalists knew this stuff. There was an herbalist in every village, that would help. And they say, but bone marrow is very good. And bone broth is good for nourishing the bones, definitely. And like I say, the herbs in that book by Susan Weed, she's got some other things that are good for that. And I'm gonna go. Sorry, yeah, there's the Susan Weed book. The formula that I like the best, it's from MAPI, Maharishi Ayurveda, right there. It's called Osteo Relief, and it's good for bone and joint health. It helps nourish the bones, and it helps with deep-seated bone issues. It's got Indian frankincense in it. Remember before I mentioned, that's the first ingredient. I mentioned before, like it's a myrrh. It's related to the kaishur. It's got Indian frank. The second ingredient is ashwagandha. You may have heard of ashwagandha. Ashwagandha is Winona semiphoria. I hope I'm pronouncing the Latin name right, but it's it's called the strength of the horse. It gives us strength, ashwagandha. So that's the second ingredient. The third ingredient is licorice and then turmeric. And turmeric has become a really big thing for inflammation because of the curcumin in the turmeric. And then as it goes down the list, it uses things like ginger and long pepper in this formula, because again, that's to help the body enkindle our digestion. And I want to just spend a couple more minutes just talking about what that means. Because when people come to me for a consultation, I ask them a lot of questions, and usually I say, "Well, how's your digestion?" And they go, "Oh, it's great, it's fine." And I said, "Well, okay, well, how do you when you wake up in the morning?" "Oh no, I don't eat breakfast. I'm not hungry. I don't get hungry till like 10, 11 o'clock." Well, I was like, "Wait a minute. Okay, pull back the clock. That's a low agni. That means that we're not, our digestion's like a little flame. It's gone down to pilot, so we don't wake up hungry." Or some people might say like, "Oh yeah, I get really hungry and boy, I have to eat right away because I get like the hangries." So that means the things might be a little over. So there's different ways of describing digestion in Ayurveda. It could be tiksha, which is too sharp, could be manda, too slow, or could be I think I forgot. It's uneven. Yeah, it's like up and down, up and down. So how do we enkindle our digestion with herbs? One of the things I love to do is take ginger, American ginger root, like organic ginger root, and chop it up and make ginger tea. It's cheap. I think it's probably less expensive than buying ginger tea, that you get in packages, and it's certainly fresher and stronger, and it will help enkindle the agni. You can slice that ginger too and make it into like a dime size thin slice. Sprinkle a little bit of salt on it and take it to enkindle the agni. There's other herbs too that help with digestion, but that's one of the main ones. And when you have good digestion, then, also people will say, "I have good digestion, but I can't eat X, Y, and Z. I can't eat wheat. I can't eat this. It makes me sick. I have all these allergies." Well, John Juilliard, who is a big name in Ayurveda, would say that, he has a book called, I think, Eat Wheat. And if your digestion's strong enough, you can digest anything. And I always think about that and I think, wow, I could even maybe digest nails. Remember stone soup when you were a kid, that story about stone soup. But when your digestion is strong, you aren't as prone to these food allergies. I'm not going to say a blanket statement about that, because yes, there are people who have celiac, who cannot eat, wheat, and it's a complex thing that is beyond what I know right now. But I do see it a lot when people say, "Well, no, I'm just not hungry." And so you want to be hungry. You want to have your biggest meal at noon, because it's when the sun is at the highest in the sky. It's when your digestion is stronger. If your digestion isn't strong, you can improve it, and it will take time, but it will happen. And any kind of, like I say, if you're having bone issues, it's always good to talk to your doctor first, and then say, "Hey, I heard this seminar about bone health, and I thought I would give this person a call and try a consultation and see if she could, help me with a few things, maybe herbal ideas or sleep sculpture." That's another one. I think that's the fourth pillar of health I hadn't talked about, but the sleep is important to our health because our body needs that rest at night. That's when our organs replenish themselves and our nervous system, comes back, goes offline to get online when we wake up. So I hope you found this helpful. I'm going to turn off the slideshow. Hopefully. Get that back up there, and yeah. And okay. All right. So I'm going to turn this. We'll stop the recording right now, but we can stay on a little bit for Q&As. I think that might be nice. So thanks for joining. And if you're seeing this on the website, I do several classes about from the Ayurvedic perspective, and also cooking classes. And happy that you could join me. Thanks.